Hey everybody, Professor Klein back here in the Human Anatomy Lab at Ohio University with Olivia, a patient who is one of my anatomy helpers this semester, and she's going to be helping teach the 12 cranial nerves. Do you know the 12 cranial nerves?
No.
We're about to learn those and teach you guys right here in this video. But first, here they are. We got to talk about how you would communicate with the patient. So number one is you always want to introduce yourself to the patient. Let's say I'm in a hospital room here, knock, 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 enter the room. As the medical professional, you want to introduce yourself, your name, and your title. Patient doesn't know if you're the doctor, the nurse, a volunteer, or some random person, right? You got to introduce yourself and your credentials. So I might say something like, I'm Dr. Klein, I'll be your physician today. All right, so the second thing you would want to do is ask for the patient's name and date of birth. What's your name and date of birth?
Olivia, December 25th, 2000.
Okay. And check the wristband, because they always should have a wristband if they're in a hospital, if they've been admitted. With that information, you've got to know you are treating the proper patient. Medical mistakes happen, wrong things to the wrong people. Avoid that by confirming this is the patient that you should be treating. Number 3, brief summary of what you're going to be doing that day. We're going to be doing the cranial nerve test here, so I might say something like, we're going to be doing some nerve testing. I heard you were in an accident. Maybe they were in an accident or had some pain or issues or something with their head, their neck, those areas. We're going to figure out what's going on today. At any time, if you have any questions or want to pause, let me know as well. Notice what I did there? You got to leave out the technical jargon, right? The anatomical terms. I said the word nerve and tests and things like that, more common anatomy words, but I'm not going to say we're going to be testing your olfactory nerve, cranial nerve 1, which goes through the olfactory foramina in your cribriform plate of your skull, right? Do you know what those were?
Not a clue.
It's like, you don't have to show off your knowledge when you're communicating those things. If they ask, sure, tell them a little bit about it, but you don't have to include those things. And then notice what I did at the end. Number 4, give some power to the patient. How do you give power to the patient? You let them know it's okay to ask questions and pause. I still have a job to do with the 12 cranial nerves as a medical professional, but the more safe and secure that they can feel as I'm doing those tests, the better. And this is just what I teach in my class. I know there's other ways of doing this. If you're in med school or PT school or PA school or whatever school, you might learn more than this, but these are the general things I would teach for a medical professional to communicate with the patient. Because we're on to number 5. It's time to begin. Ready to begin?
Yes.
All right, here we are with the cranial nerves. And did you know you write these in Roman numerals?
I did.
She did know that, and actually I made a mistake and she found it in the Roman numerals. So even professors make mistakes. So thank you, Olivia, for helping me with the Roman numerals. Make sure you guys know these with the Roman numerals as we're listed out here. Number 1, dash the olfactory nerve. And this one deals with the sense of smell. So I might say to the patient, we're going to do a test for smell, and what I'm going to have you do is close your eyes and plug one nostril. Do that when you're ready, and then tell me if you can smell anything different than the air that you're smelling right now. So close your eyes if you're ready. I got this right here. Let's see if she can smell this. Okay, and plug the other nostril, please.
I can smell it.
All right. Smell pretty good?
It smells very good.
What do we got? Clementine and pomegranate right here. So, in a hospital setting, the doctor might just say, have you been able to smell over the past week or so to get a gauge for this? But this is a test specific to the olfactory nerve. And I had her plug one nostril because all of these nerves are bilateral. You got one on the right, one on the left, and you want to test them individually so you know maybe the right one's damaged, but not the left, or vice versa. And eyes closed, because as much as you want to trust individuals in your hospital, you got to make sure that they are actually telling you the truth, that they can smell it rather than just see it. So I trust Olivia on this one, but you got to cover your tracks in terms of these tests. On to number. Whoa. All right. You ready for number 2?
You like to snap a lot.
Got to do the snaps. All right. It gets a little bit more detailed with cranial nerve 2, the optic nerve. This one actually has 3 different tests because you have different types of vision. Let's start with the visual acuity test. Olivia, let's head on over here. All right, here we have an eye chart for visual acuity. And what you're gonna have the patient do is stand 20 feet away from that chart. And Olivia, would you mind covering one eye and reading the lowest line that you can read?
LETODPCT.
All right, and cover the other eye for me and do the same thing.
FDPLTCEL.
All right, Olivia, you read line 9 for one eye and line 10 for the other one. Did you know that you actually have better than 20/20 vision?
I did not. That's awesome.
Excellent vision, but what does that mean? 20/15, 20/13. Let's find out. All right, so that was visual acuity, or how clear you can see something. So Olivia was better than perfect vision, and I'm giving it air quotes here because 20/20, we call that perfect vision, right? But in reality, you can be better. What 20/15 means is what the general population can see at 15 feet. Somebody with 20/15 vision can see the same visual acuity at 20 feet. That's 5 feet further, and they can see the same clearness. 20/13 is even better. The world record that I've heard of is 20/7. Comment if you know anybody that has better than 20/7 vision. Do you know?
Absolutely not. That's crazy.
She could be the next. We gotta train you to get down to that world record here. If you play in the major leagues or fly an airplane or things like that, you gotta have, on average, better than 20/20 vision. But there's another type of vision. Hang here. And Olivia, tell me when you can see my wiggling fingers.
No.
What type of vision is this?
Peripheral?
Yes, this is peripheral vision right here. You not only have visual acuity, which was this chart, but you also have peripheral vision, which is how you can see on the sides as you're looking straight forward. There's one more test for the optic nerve, and it's called the pupillary light reflex. Here's how it works. You want to take a pin light or even like a bright light flashlight on your cell phone, and you're going to take this light and you're going to shine it right in the individual's eye. Now, what would happen if you shone a bright light into someone's eye? Well, do you ever wake up in the morning and turn the lights on real bright? in the morning. Does that hurt?
Yeah.
That's painful, right? Too much bright light can damage your eye. So did you know your body has a built-in reflex to close off the pupil or constrict the pupil, which means make it smaller and prevent too much light from getting into your eyes? Do you know that?
Now I do.
She does now. I didn't know that when I first started taking anatomy because it's involuntary. You don't have to think about it. That's what a reflex is an involuntary response to a stimulus to protect your body. So I would come in, I'd take the pen light, and I'd just say, go ahead and look forward. Shine it in one eye. Shine it in the other eye, watching for the pupils to constrict. All right, you guys saw it close up. To confirm, Olivia, you didn't do anything. You didn't contract your muscles. It just did that on its own.
I just looked straight forward. That was all I did.
That is the pupillary light reflex. Time for number, or actually 3 together, called ocular motor, trochlear, and abducens. I say 3, 4, 6, make your eyes do tricks or movement. So 3, 4, 6, those number cranial nerves are responsible for eye movement. Do you know what muscles move the eye?
Don't.
Let's find out. All right, here's the eye, and here are what we call the 6 different extraocular muscles. There are muscles attached directly to your eyeball, 6 of them total. And these pipe cleaners are representing the 3 different nerves that innervate these 6 muscles, 3, 4, and 6. It's popping up on your screen right now of the specific muscles innervated by the specific nerves of 3, 4, 6. But how are we gonna test this? Well, let's do an eye test, but eye movement. And if you've ever had this happen, someone holds something in front of you and they start moving it, and you have to watch with your eyes. I want you to look straight forward and just watch with your eyes. And I'm going through what are called the 6 cardinal planes, and watching to see Olivia's eyes follow the pen. And the last one we call convergence, or bringing it straight to the middle. So patient was unable to, let's say, move their eye this direction. When you move the pen this direction, one of those muscles might have some nerve damage to it. And that's how you figure out what's going on with any of these cranial nerves, right? Is what can the patient not do or not feel, either sensory or motor, and then you track it back to a nerve. Now, you're never gonna have a patient come in and say, my cranial nerve 3, 4, and 6 have been damaged, right? That just doesn't make any sense unless they know anatomy. They might say that. Olivia might come in and say that, or I might come in and say that. But the general population, they don't know that. But they're gonna come in and say, my eye doesn't look outward, or doesn't look up, or something like that. And you have to track it back from what the patient cannot do or cannot feel to the damaged cranial nerve. All right, ready for number 5?
Yeah.
All right, we're on to number 5, V, which is the trigeminal nerve. Now this one, it's special. It's got 3 different divisions to it, and you can see these 3 right here. They're called ophthalmic, maxillary, and mandibular, and you can also abbreviate them V1, V2, V3. But make sure you know the names as well. What does this cranial nerve do? Well, it's sensory and motor. Sensory of the face. The skin covering through, oops, got my glasses. There are the three main areas of the face for sensation. So how do you test this? You want to take a little bit of clean gauze and have the patient close their eyes and then just tell me when you can feel the gauze. Just like that. And you want to mix up the speed, right? Don't just do it uniformly, kind of mix up the speed. Really make sure that they are feeling that sensation and responding when they do versus just guessing the timing. But there's one of these three divisions which has another function, a motor function, and it deals with chewing. Chewing technically is called mastication. So there are muscles of mastication or chewing right here. This one is called the masseter. This one's called the temporalis. It's been cut off, but it would go up to the skull. Now these two allow for elevation of the mandible, which is the jaw. And when you chew, let's get this guy chewing here. That's what you do, right? Is gravity depresses the mandible and then you elevate it to chew. To test this, I'm gonna have the patient go ahead and clench their jaw and feel the sides right there. Do you feel that? What's that feel like when you do that?
It's almost like your jaw is like popping out sideways. You can kind of see my hands moving.
Oh yeah.
That's because I'm clenching.
Okay, try that at home. Go ahead and clench your jaw real tight. See if you can feel the masseter muscle, which again would be right here. Now, can you do the same thing for the temporalis?
Oh gosh. I can feel it. You can't see it as well.
Oh yeah, you can definitely feel that. It's not as big of a muscle. In fact, the masseter muscle, pound for pound, the strongest muscle in the body relative to its size. Did you know that?
I didn't.
Dropping some knowledge bombs here on the masseter muscle. There's no machine at the gym though for the masseter muscle, so don't go looking for it. It's already very, very strong just from chewing. All right, Olivia, how are we feeling? We're about halfway through.
I'm remembering some of them, a few.
Are you ready for our test right now? Maybe not right now, but at the end of this video, I'm gonna drop some example quiz-like and exam-like questions on the cranial nerve. But we're ready for the next one. Number 7, facial. Facial nerve is talking about the facial expression muscles. Olivia, can you go ahead and smile real big for us? And frown. And squint your nose up real tight. Raise your eyebrows. Perfect. Those are the facial expression muscles. Different than the muscles of mastication. So cranial nerve 7, facial expression muscles. Which would be not the temporalis, not the masseter, but all these right here. Number 7. Now, what's that clinical condition called when you have damage to the facial nerve resulting in, let's say, one half of the face kind of drooping or not contracting? Take a second, think about it. Do you know?
I think I know.
This, all right, Olivia thinks she knows. It's not the one with the brain, but it's the one just with the facial nerve.
Maybe not. I was gonna say stroke.
Stroke is the one with the brain, which has similar symptoms. Very serious. Get that person to the hospital if they have any sort of paralysis of the face. But this one is related to the facial nerve, and it's most often temporary. A couple months, it goes away. Infections can cause it. Justin Bieber had a version of it recently. I'm talking about Bell's palsy. Bell's palsy. So that'll be on the quiz at the end of this video. Let's go on to number 7, the second part, because we got to talk about the sensory component of number 7. And I have a drawing of the tongue. This is the tongue right here. This is my artistic ability. The tongue is where we taste things, right? Taste buds all on top of the tongue and the sides, but it's divided. The anterior 2/3 of the tongue for taste is innervated by cranial nerve 7. So those taste buds actually have nerve innervations to them. Do you have good taste?
I'd say, yeah.
It's kind of an interesting thing to ask, right? Good taste in music, good taste in, you know, whatever. But this is actual flavor taste that I'm talking about here. Anterior 2/3 of the tongue, 7. What about the posterior 1/3? That's number 9. 9 is the glossopharyngeal, which glosso means tongue, pharyngeal means like throat or pharynx, the back of the throat area. So the glossopharyngeal is going to deal with the tongue, and posterior 1/3 for taste, and then a couple things popping up on your screen for the throat. But let's not skip over number 8. All right, join us in some snaps here. 3, 2, 1, boom. All right, always gotta be ready for some snaps to transition to the next one, which is the vestibulocochlear nerve. Olivia, would you mind hopping up and standing on one foot? And I'll confirm she's on one foot right here. All right, could you move to the other foot? Awesome, have a seat there, have a seat. That was testing for balance. How about this one? Go ahead and look straight forward. Can you hear this rustling?
Yeah.
Can you hear that? Okay, try that at home. Did you guys hear that rustling? That is testing for hearing. And you gotta make it really quiet because you wanna see if the person can hear. Both those things are the vestibulocochlear nerve. But what does that nerve mean? Cut it in half. When you cut it in half, it's got the word vestibulo, which means balance, and the word cochlear, which means hearing. And those things are actually both found deep in the ear. If I take this off right here, do you guys see this snail-shaped thing? This is the cochlea, which has the cochlear branch coming off of it, and this is the vestibular apparatus, which has the vestibular branch coming off of it. Together, this nerve is the vestibulocochlear nerve, balance and hearing. All right, we're on to number 10, the vagus nerve. Yes, I'm talking about Viva Las Vegas right here. Ever been to Vegas?
No.
Me neither, but it is pronounced Vegas, and I use that analogy for this nerve because this nerve does a ton. Vegas in Nevada is a huge, huge city. This nerve is a huge nerve. It's going to innervate the throat, the esophagus, the lungs, the heart, the intestines, the stomach. Here's a full list right here, but it does a million different things. And have you ever heard the phrase, go with your gut? Or like trust your gut? Are you pretty good with that? Like knowing something's the right thing to do, or on an exam, you're like, I know it, it's probably this one. My gut is just telling me it's the right answer.
Yeah.
Well, that's actually scientifically founded, and there's a link between your intestines and your brain, and one of the main links is the vagus nerve. So that's a real thing.
That's crazy.
Trust your gut. It is trying to tell you the right thing to do. But that's the vagus nerve. We got two more here. Let's go on to number 11. All right, number 11 here, XI, is the accessory nerve. Now for this one, I'm gonna have the patient go ahead and shrug your shoulders. Let's go ahead and give a couple shrugs. That is testing the trapezius muscle, one of the two muscles innervated by the accessory nerve. And then Olivia, can you turn your head to the right, turn your head to the left? Turning your head test for this muscle right here called the sternocleidomastoid. Both the trapezius and the sternocleidomastoid are innervated by the accessory nerve. Now here's how I teach students to remember it. Olivia, do you ever accessorize or wear like accessories? You're going out, whatever, going to a movie or something. What's an accessory that you wear?
Maybe a necklace.
Necklace. Now, a necklace would touch the trapezius and the sternocleidomastoid. So remember, when you accessorize, accessories like a necklace is going to touch those two muscles. Ready for the last one? We got one final snaps coming in here. Do it with us. 3, 2, 1. All right, gotta have a little fun with these videos in anatomy as we get on to our last one here, the hypoglossal nerve, number 12. Remember what glossal means? Do you remember? Glossal is tongue. Good, good. Take a second to think about it, but glossal is tongue, like the glossopharyngeal nerve dealt with the tongue, but that was taste. Hypoglossal, do you know what hypo means?
No.
Hypo is underneath. So what is underneath the tongue? Well, let's bring in the tongue right here. And there are muscles that move the tongue underneath the tongue. So you would have the patient stick their tongue out side to side, like you can see in this picture popping up on your screen, to test the hypoglossal nerve. All right, that's all 12 of them. Remember, these are paired nerves on the right and on the left. Some are just sensory, some are just motor, some are sensory and motor. Make sure you know all the components. In fact, I think it's time to test you and Olivia on these cranial nerves, so don't stop watching yet. I got 2 more minutes to test you guys, and we're gonna do it in a real life scenario. So if we got the patient here and I start asking her to do some of these tests and some things are abnormal, I want you guys to notice what's abnormal and what cranial nerve that would be dealing with. So let's start with the test where Olivia shrugs her shoulders. Go ahead and shrug your shoulders here. Let's see if it's normal. Do a couple shrugs. Okay, it's not normal. Make a note of what cranial nerve might be damaged. Here are some options for you. Let's do another test here. Olivia, can you go ahead and tell me if you can hear this?
I don't hear anything.
Can't hear that? Okay. Something wrong with the hearing. What cranial nerve would be potentially damaged? Here are some options for you. Okay, no more options. Multiple choice is gone, and now we're talking about some other ones. Olivia, can you tell me if you can feel this gauze on your face with your eyes closed? Okay, get real specific with your answer. Can you feel this?
Are you touching me? I don't
Feel this
anything.
right here? How about this?
No.
How about this last one?
Mm-mm.
Okay, how about the other side?
No. No. Mm.
All right, no sensation of the face, and I want you to tell me the 3 different divisions that would be affected in order from here to here to hear. And I got one last one for you. Olivia, go ahead and close your eyes and plug one nostril. Tell me the name and the Roman numeral for all these. Can you smell that?
Mm-mm.
Other nostril, please. Can you smell that?
No.
All right, the candle right up in her nostrils, and she could not smell it. What cranial nerves have been damaged? I'm going to give you the answers to all those in 3, 2, and 1. All right, comment how many you got correct on there, and I'm going to ask Olivia. I'll put Olivia right on the spot. What are 3 things that you learned from helping with this video?
I learned when you're with the patient to always ask their name and their date of birth. I learned that the accessory nerve deals with the neck area because the necklace is an accessory. And I also learned that you have eye muscles that connect right to your eyes. I did not know that.
All right. Comment what you learned down below, share your knowledge, and be confident when you know these. These are the real tests for the cranial nerves. All right, I'm Professor Klein.
And I'm Olivia.
Thanks for watching.